in paying for the remote monitoring of the individual because they see an ROI around that. And that's an example where there isn't a direct reimbursement, but there is kind of under this concept of healthcare and the way care payments or payments for care are done, a care provider is paying for it. If we think about remote monitoring of hypertension, that is more of like what we might think of as a disease management program, right? Because when Partners looks at that, it's very hard in today's payment models to say, that's worth doing because just to what Zachary you were talking about, oftentimes it leads to actually a reduction in office visits. And while no primary care practice really has a difficulty with having open slots in their schedule, and when you start to talk about moving, significant percentages of their office visits out in a way that isn't reimbursed, pretty quickly the business managers step in and say, well, wait, right? We have to think about this. So that disease management space has traditionally been filled by payers doing it, insurance companies, right? Doing it through their disease management companies. Partners is investing in it because we believe what's happening is the way we're going to get paid through pay-for-performance contracts for our care delivery is going to change, and that's going to be in this technology and this process is going to be an enabler for us to meet those challenges. The last example is a wellness program, and the wellness programs we actually sell directly out to self-insured employers. Right, so those employers, those large companies are buying today other wellness programs. They're used to investing in this way. Maybe they're doing it with their health insurance partner, right? But the person who's the group that's paying for it is actually the employer, and it's not part of what we might think of as care delivery payments. And frankly, that's one that is a challenge. So I need to be really clear because this is out in public. Partners actually needs to be really careful about delivering that because it's not care delivery to do that wellness program. And it's a boundary that we have to be very careful about walking around because we're a nonprofit care delivery organization. Offering out wellness programs is a for-profit activity. So the way we have to offer it today is under some very controlled kind of research structures. And this is one of the market challenges that I was kind of pointing to in terms of who pays for it and under what conditions.
Thanks, Doug. I think we're kind of wrapped out of time. Sorry about that, but and that's just kind of an indication of the interest. And I think all of the folks here will be available if you have other questions later on.